All right, thanks, Linda. Well, this morning we're going to take a run at this from two different angles. The political aspects of health care reform and where we stand right now, and then a little bit later on, Linda will have a guest talking about what's actually in the bill and how it affects you directly. But let's start with the politics, and our political analyst, John Dadian, joining us here this morning on Sandiego 6. Good to see you again.
Good morning.
All right, so it is the law of the land now, so we can dispense with all the discussing of, whether it's good, it's bad, but it's the law. No, but there are political ramifications.
It is the law, but again, they're going through this reconciliation process. I talked to a congressional aide yesterday, and he says they're standing by this weekend that they think that it's going to come back to them. So we really still don't know what the final product is going to be.
So in the reconciliation bill, though, and it's funny because it's like 153 pages as compared to over 2,000 for the original bill, and that's still a big package of paper compared to what legislation was just a few years ago.
Again, this only passed by a few votes, et cetera, so the strategy is if you start peeling off here or there, who knows what the final product is going to be.
Well, let's talk about the vote for just a moment here. The final vote was 219 in favor of this, and with 34 Democrats voting no. Did they really vote no, or were they allowed to vote no once the Speaker knew she had enough votes? Were they allowed to vote no to give them political cover down the road for their re-election bids?
That certainly was part of it. Again, when they were trying to get to those magic numbers, supposedly the Speaker was overheard saying that nobody wanted to be that final 216 vote, so they had to get up to 217 or 218. So that absolutely was part of the strategy. I think the biggest point on this, because this is considered landmark legislation, nobody can remember any landmark legislation that was not bipartisan. But on this one, all of the Republicans voted against it.
All the Republicans voted against, and yet there are aspects, I was talking about this with the boss the other day because, she was pointing out it is so important that we try to remain fair and balanced and shoot right down the middle on this, and yet just by virtue of talking about one part of this bill or another, it appears you're trying to come down on one side or the other because people are so charged up about this.
Absolutely, and it was interesting the different strategies. The Democrats tried to put this as a human rights and the civil rights type issue that people need health care. I personally think the Republicans lost their message. They should have stayed on point by saying that we can't afford this economic issue.
Now, there are some things that everybody seemed to agree on, but rather than taking it piece by piece on the things that could be bipartisan, you ended up with this huge bill, which what that means is it's going to be years down the road as people continue to realize what's actually in here and how it truly affects them, not just what the politicians say.
The American people are confused, and the members of Congress who voted on it, I think, are still confused.
I've got one poll here from CBS that says only 20% of people polled believe that health care measure will help them. 20% believe that the reform will help. 35% say that it will hurt, and 38% say, oh, it'll have no effect at all. Is it likely that it will have no effect on that large a group of people in the United States?
Oh, I don't think at all. I think it will absolutely have effect on everyone. Again, some, depending on point of view, help or hurt.
All right, let's talk about the Democrats now and the elections coming up in November. If truly three-quarters of the American people, by some polls, again, it just depends on which poll you take, if that many people did not like this bill in that form, is that really going to hurt the Democrats in November?
Oh, I think absolutely. The Republicans right now, their strategy is there's as many as 50, and to me that's a very large number, 50 Democratic incumbents that their districts went for McCain in the 2008 election that the Republicans are going to target. Now, ironically, that for the California districts, both for our San Diego delegation and for the state of California, really doesn't affect us that much because our districts are so heavily gerrymandered. It will have a huge impact in districts throughout the country.
And let's end on what I hope will be a light note here. Joe Biden, he does not seem to be aware when there's an open microphone around, or if he is, he just really doesn't care. But when you start dropping the F-bomb on a day that the president has said is one of the most historic days in the history of our country, should we care?
Well, to say the least, it's an understatement to say that this was a historical moment. What historians like to do is they like to give administrations labels and names. For example, they gave FDR the New Deal. Harry Truman was the Fair Deal.
Oh, no, I know where you're going with this.
Does a vice president really want to say that this administration is going to be known as a big bleeping deal? That's what's the headlines in all the papers.
Do you think he knows when he does these things?
Absolutely. He thinks it's part of his charm. A lot of people disagree with him.
Okay. Well, anyway, it's said, it's out there, and I'm sure it won't be the last time that Joe Biden gives us a quote that we have to bleep.
Literally, it is in the history books.
Okay, so that's kind of the politics up to date. Thank you so much, John. And again, we'll talk about the actual medical parts of this bill coming up here shortly.
Very good.
Thank you so much. Good to see you.
Good to see you.
All right, for more information, you go to Sandiego6.com and you click on Hot